Welcome, students of the UUM School of Computing. I am Dr. Alaa Jabbar Almalaki. We are analyzing a field of technology where a system outage results in threat-to-life crimes. Cyberattacks on our clinics and hospitals have reached extreme levels. High-impact ransomware is shutting down critical medical systems, forcing doctors to treat patients without the data they need to keep them alive. The financial damage mirrors that physical disruption. For 13 years, healthcare has remained the most expensive industry to suffer a data breach, with the average cost per incident now exceeding $10 million. Looking at the sector from the outside, you face a complex layer of regulations and hardware: HIPAA, HealthTech, and IOMT. This creates a high barrier to entry when the path isn't clearly defined. Today, we are going to bridge that gap with a concrete roadmap, transforming a systemic vulnerability into a stable, specialized career path where your engineering skills support the future of patient care. This diagram shows the 4 pillars that separate HealthTech from general enterprise security. First, the data. Protected health information, or PHI, includes medical history, genetic data, and prescriptions. A credit card can be canceled and replaced. A medical record is permanent. This makes it a high-value target on the black market. Second, the stakes are physical. When a hospital's network fails, emergency rooms are forced to operate blind. Doctors lose access to critical histories, and surgeries are delayed. Your security program is a component of the clinical care team. Third, you operate within a strict regulatory framework. HIPAA is a federal law with severe financial penalties. Technical controls like strong encryption and multi-factor authentication have transitioned from recommended best practices to mandatory legal requirements. Finally, we have the Internet of Medical Things, or IOMT. Modern hospitals rely on smart infusion pumps and connected MRI machines. These embedded systems often lack the capacity for standard antivirus software or routine reboots for patching. This combination of high-value data, physical risk, federal law, and vulnerable hardware creates a perfect storm of demand for specialized defenders. This matrix plots 7 core HealthTech cybersecurity roles based on technical depth and required experience. This sector is a diverse ecosystem of specialists, each playing a vital part. The defender and builder paths focus on infrastructure. If you specialize in networking and prep monitoring, roles like SOC analyst or network security engineer offer base salaries starting at $55,000 and scaling well past $110,000. The enforcer and leader paths are for those who excel at policy auditing or cloud architecture. Governance, risk, and compliance analysts, along with cloud security engineers, command premium ranges starting at $90,000 and exceeding $155,000. You do not need to master every role on the board. Success comes from identifying the single quadrant that aligns with your specific strengths in computer science. To enter this field, we build a skill pyramid. The bottom layer is your technical foundation. Your current coursework in TCP/IP, Linux, and Windows systems is essential. You must understand how data moves before you can learn how to protect it. The middle tier is your specialization. This involves mastering IOMT vulnerability scanning and mapping network configurations directly to HIPAA compliance requirements. At the peak of the pyramid is the ability to translate technical risk. You must be able to take a complex technical vulnerability and explain its clinical impact to hospital executives and medical staff. Without the ability to communicate with clinical teams, your security controls will be viewed as a roadblock to patient care. Success requires technical brilliance balanced with empathy for medical workflows. Step 1 of our blueprint is locking down your IT fundamentals. Step 2 is validating that knowledge with a global baseline certification, specifically the CompTIA Security Plus, to prove you have a verified level of foundational knowledge. Step 3 is building a home lab. Using free virtualization tools, you will build a simulated hospital network on your personal machine. This includes a pfSense firewall to create network zones, a Windows server, and an attack node to test your defenses. You launch a simulated attack from your Kali node, watch the alerts trigger in your monitoring interface, and then write a firewall rule to block the traffic. Step 4 is documenting this capability. Instead of writing "built a lab," you will state that you designed a segmented network to simulate the isolation of critical medical infrastructure. For Step 5, I want you to look back at the career matrix. Identify one role that matches your strengths and write down exactly which virtual component you will install on your machine this weekend to begin your lab. This lab is the exact mechanism that bridges the gap between university theory and the practical requirements of an enterprise security team. This sector offers extreme job security. Average job market growth is 3%, while demand for security analysts will increase 32%. Entry-level roles start near $55,000. Mid-career specialists exceed $100,000, and hospital CISOs scale toward $400,000. These figures are a reflection of a permanent global talent shortage. With nearly 4 million unfilled cybersecurity jobs, the healthcare system is desperate for defenders who understand both the technology and the mission. Students of the UUM School of Computing, the path is clear. Use your time here to build your foundation and your lab. Drop a comment below with the career path you've chosen, and let's begin the work of protecting the future of healthcare.